two of my favorite things. One, talking about prolapse, and the other is talking about leakage and impact. And I've been having some fun. Yeah, Abby's here, wants to be loved. I've been having some really interesting, it's fun to me, conversations about things that I think we keep telling new moms or women that are just newly running into these issues. I think the messages that are getting handed down initially are oversimplified. Like, you have prolapse, there's nothing you can do about it, do Kegels, that sort of thing. You've got leakage, nothing you can do about it, do Kegels. Like, I feel like the tide is slowly starting to turn because I think women are having easier access to information. They're asking better questions. They're realizing potentially that their care that they're getting from their provider may not be best evidence. Example of that I posted in a story earlier today about, somebody that's like, somebody gave me a pessary, but is it stretching me out? I don't want to do anything that's going to stretch that area out. I want it to be supported. And I'm like, I don't think the average person is taught what a pessary is, what prolapse is, all those sorts of things. And I think some of where that comes from is, I don't think we've understood it well ourselves. And so this is where I think moms are going to gaslight themselves and be like, oh, it's my fault, nobody told me. I think our profession, like physios, are just finally getting a really good sense of what these things are, the mechanisms for prolapse, the mechanism for leakage, things like that, because I think we're just getting a much better understanding of the anatomy of the pelvis, the three-dimensionality. It's so much more than like the hammock of the pelvic floor. It's like, yes, we need to understand muscle activity and bones and those sorts of things, but also like, is there ligamentous injury, fascia, tendon issues, those sorts of things. We need to consider kind of what the structures are. Is there support? Do we need to provide additional support? And then when you put a pessary in, which is a support that can help with leakage or pressure, what is that actually doing? And so I think as we are understanding that more as providers and getting more information, I think we hopefully are doing a decent job starting to pass along that information. And so we have patients that are asking better questions. But I love the tendency to need to simplify. I had a quick little chat with Tina Tang. She's a fitness trainer specializing in plyometrics up in Jersey City. And she's actually going to be on the podcast. I think we're going to chat sometime in May or June. And she's like, let's talk for 15 minutes about why we pee during jumping and plyometrics. And I'm like, should I tell her that this is a far bigger conversation? And the thing is, we can have these big conversations and we can continue to be learning. But what are those? I know you're so upset. What are these small little bits of information that we can pass on to the average person to at least help them, good grief, understand what's going on with their bodies? Because I think it's the lack of understanding that freaks us out. And what we're being told in our appointments does not mesh with the two-dimensional, image that we were given in like middle school health. And we can't reconcile those two. And then we freak out and then we have symptoms and so on and so forth. So I think there's going to be a huge shift in as more of us are understanding things deeper, providing more education, people are absorbing that education, asking their providers more. I think there's going to be a huge shift in that. If you are not keeping up with the literature, if you are not keeping up with current practice patterns, those sorts of things as providers, your patients are going to know. And those of you that are patients that are trying to learn and DIY this stuff, I think what's really important to understand is, yes, you may need to educate more than you thought to advocate for yourself. Yes, you may need to vet your providers, meaning not everybody is the same. But I also think what's important is you also need to understand when you can DIY it and when you need to find somebody that can help you navigate those problems. And this is what Tina and I were talking about kind of after we got off her podcast was, what basic information can we provide to people that a generalized recommendation can provide some benefit. And for some people, they can feel completely better and they're all better, and that's great. Some people may be a little bit better, and some people it may not change at all. And the people that really need to find us as providers are going to be that group that don't respond to group recommendations, that group of people that if you give them some generalized recommendations, they don't respond to that. But that's where I do appreciate the role of a lot of these coaches and trainers, pregnancy, postpartum athleticism coaches that have stepped up, and they're kind of filling in that gap. It's like the more education we can provide, the more screening that we can do, then we can really save those problems that really require a nuanced look, and somebody used to problem solving and critical thinking and looking for patterns and things like that. We can really be more efficient with how we utilize our providers, because obviously there's not enough of us. So big picture, everybody's learning more, everybody's communicating more. I think everybody's demanding better care and better understanding and options. I hate it when people treat PT and pessaries and things like that like we're a controlled substance. Like, I am not crack cocaine. Like, I'm just not. Please do not treat me as such. We shouldn't be gatekeeping information, we just shouldn't. So would love to know what you think, what your experience has been with this whole system. Are you navigating leakage and jumping? Are you navigating prolapse and pessaries and all that stuff? What's been your experience like trying to find information, trying to find providers that are familiar with updated information? Where are you in the world, and what are those differences? Because that's one thing I also see too, is a lot of countries that you would think would be a little bit more up to date, we're practicing completely differently here in the States, and they may be 5, 10, 15 years behind at least where we are as far as active population. So drop in the comments, shoot me a DM, let me know. Work to do.